I started out, like a normal kid in high school. I used to just smoke regular flower weed with my buddies. And then one of my friends introduced me to a dab rig, and it would get to the point where I was having to smoke that pen like every 30 minutes in order to keep the high up.
Concerns about marijuana used to be the stuff of reefer madness. But in Colorado, already a decade into legalization, high-potency products are birthing new critics.
We've had legalization here now for a long time, and it has just wreaked havoc on a generation of our kids.
Despite the millions in marijuana tax revenue, some residents feel there have been unintended consequences.
The youngest kid I've seen that's addicted to pot is 7. It doesn't matter what kind of parent you are. Cannabis in our community is everywhere. For a child, it's as simple as going on to Snapchat, finding out where they're dealing it, and going and getting it.
Karen Randall is a doctor at a large hospital in Pueblo, Colorado. Sometimes touted as the Napa Valley of pot, the former steel town invited the marijuana industry in to try and boost the city. But according to some residents, it hasn't worked out quite like that.
Here it is, like in all its glory, the Napa Valley of cannabis. Yeah, that's what the Napa Valley looks like.
A study in Colorado found marijuana-related calls to poison control centers more than doubled around the time recreational products hit the market in 2014. A separate study showed vomiting-related cases in the state also rose 29% from 2013 to 2018.
One of the big ones that we see every single day is what we call scrombodyne, and it's a combination of screaming and vomiting that is really kind of peculiar to cannabis alone.
I would be vomiting often. I used to weigh 150 pounds. I got to the point where I was weighing 117 pounds. So I went to my psychiatrist. He actually did a scope to see if I had gallbladder cancer or something, which I didn't, and there was nothing wrong with my GI tract. He asked me, do you use substances? And I said, yeah, I use marijuana. He told me that you can use too much to the point to where it's called cannabis hyperemesis disorder, which is where I was at.
Dr. Jesse Hinckley of the University of Colorado first became concerned about cannabis after seeing some youth admitted to inpatient psychiatry.
These were youth typically without any sort of previous psychiatric history who were presenting acutely psychotic, so hearing voices, seeing things, paranoid, delusional, and pretty abrupt onset typically after a period of heavy cannabis use.
Of more than 4,000 marijuana-related visits to emergency rooms or urgent care in Colorado, 5% were diagnosed with schizophrenia or psychosis. That's compared to less than 1% among the general U.S. population.
Most people don't even know what's for sale in dispensaries, like, do you know what dabbing is? Or shatter? And they make them in flavors that are appealing to kids. Scooby Sacks flavored, Girl Scout cookie, birthday cake flavored.
Dawn Reinfeld helped form the group Blue Rising to advocate for gun control, but they've turned their attention toward reforming marijuana laws, the very same laws that some of them voted for.
Look, if we want to say that you need to follow the science on climate, on fracking, on COVID vaccinations, then we should be following the science on high-potency THC.
But following the science isn't as easy as it seems. There's no consensus on what level of THC makes the product high potency. The market is also flooded with synthetic variations, confusing matters further.
It's a humble sour.
Raw flower usually starts at 20% THC or higher, up steeply from the 4% levels of yesteryear.
What are the facts about marijuana?
Concentrated products like vape rarely start below 60%. Many extracts like dab, wax, and shatter go above 90%.
It was my birthday party, actually, so I took a dab, and that was about 75% THC the first time. And then eventually I found out that I could just get the dab pen, which would last me longer, and turn be cheaper. So 2 years of just daily use at 98% THC.
Recreational marijuana is legal in 23 states, but remains illegal under federal law. The U.S. government is gathering data towards a pledge to reconsider legalizing by the end of 2023. While Germany is also drafting regulations to start recreational use.
I asked our hospital how much it would cost just to see a patient get IV fluids and some medicines. It would be about $5,000 to $6,000 for an ER visit. We see at least one a day. So if you go, okay, that's $5,000 times 365 days, that's $1.8 million. And then if you times it by 25 ERs in Colorado, that's millions of dollars.
Spent on just the squatting cases
on
alone.
squatting alone.
Treatment for America's drug habit often comes down to mental health care, which sometimes isn't covered by private insurance. Many such patients rely on Medicaid.
We're just cost shifting, right? They're taking money in and we're cost shifting their medical care to the general public. If you look at the trends and the numbers, not only did cannabis go up, and the industry will say, well, of course it went up because now it's legal and everybody's using, but methamphetamines went up, cocaine went up, opiates went up, and my test doesn't test for fentanyl, and of course fentanyl's gone up. We're reaching the record number of deaths.
In January 2022, Colorado started using a tracking system that limited daily THC concentrates per customer. The compromise, reached by legislators, Blue Rising, doctors, and the local cannabis industry, had immediate impact. Medical marijuana sales fell, about 7 million. Overall marijuana sales also contracted, falling about 44% below their peak of 226 million in 2020.
It's legal here, it's going to stay legal, but how can we have a regulatory framework that protects public health?
For the legal marijuana industry, the stakes are high. This year in the US, more than a third of the $34 billion in expected cannabis sales will come from products with high levels of THC. The US Cannabis Council says millions of Americans regularly consume marijuana products without any issues. Confusingly, some studies have shown that marijuana can have both beneficial and detrimental effects on some mental health conditions. But the industry can't deny that the legal market has created a new breed of supercharged products.
I honestly believe that if we had left cannabis at the previous potency, if they had left it at 2 to 3%, we probably wouldn't be talking